Sure, sure. All right. Hello. Hi, I'm Manit from HTAP. So today I will walk you through our recent work. It's a series work under the CISIT initiative. It's called Science is Only Half of It, Expert Perspective on Operationalizing of Infectious Disease Control Body in the ASEAN region. Just to set the scene, as you may know, that infectious diseases do not respect the national borders. So no one is safe until everyone is. As the very obvious example that happened this day is COVID-19, right? That's spreading around the world and presenting negative impact on our social economy and society as well. And more importantly is in terms of our safety measure, I mean, incoherent safety measures when we impose in a society. It had caused a lot of detrimental effect, like stockpile of goods and products, vaccine, etc. And even sudden closure of the borders also caused this passenger stuck in one country, for example. So this just signified the importance of having collective effort or transnational, way of addressing the pandemic. So with such reason, ASEAN has decided to establish a so-called ASEAN CDC, or it's called ACPID, very long name, just to be at the center of excellence, just to help with capacity building and also how we could address public health crises now and also in the future as well. But having said that, the operationalizing of such regional health center, it's quite challenging. So aligned with that mission of ASEAN and also ACPID as well as an academic group, we would like to synthesize some insight that we could perhaps inform to relevant stakeholder in terms of operationalizing such regional center. And more specifically, we want to learn in terms of what kind of lesson that we could perhaps pass on into the center as well, and not just in for ACPID, but also other as well in Asia. So what did we do? We used the qualitative approach using a semi-structure key informant interview with the key question in this time that we want to know, like, what lesson can expert give us in terms of operationalizing an infectious disease control body in the ASEAN region. And the way that we sampling participants is that we use both purposive and also snowball sampling. We have identified quite a lot from our previous work, scoping review, and then we also do the snowball when we interviewed people too. And the interview lasts about up to an hour and conducted via Zoom or remote area due to the pandemic and also logistic reason as well. And we use six-step thematic analysis here. Just to briefly show you the participant profile that we interviewed so far, we interviewed 23 regional experts here. Majority of them came from Asia. And we have organized theme that we found from our interview, in total 3 of them. One is governance and politics, the second is organization and management, and the last one is to do with the partnership and engagement, both external and public as well. So the first organized theme, when we talk about governance and politics, there's a lot of conversations going on about leadership and diplomacy, sovereignty and ownership of the country, and also the center, partnership development, and also political commitment and data sharing. Just to give you a few quotes that we found, it's been emphasized that this sort of center, it shouldn't be run by one individual country, but perhaps rather a group of people that come together more in a rotation way, where they could feel that they could have authority over the center and also share responsibilities as well. And also emphasize again, the ownership of this is really something important. And everybody that's involved need to be involved from the very beginning when doing the planning of the center and the function, etc. And then diplomacy as well. And also, I like to highlight something in the blue one where quite when participants say that it's not just try to ask country to conform to whatever the center would ask them, but rather the center try to understand their context and their needs, and then try to come up with some sort of support that would align with their priority and their needs more. And also, unless we have political buy-in from the country members, then anything, could be sensitive. For example, when we talk about infectious disease, so it would involve surveillance and etc. So it would involve data as well. Unless they feel like willing to share such data, then surveillance may not be that effective. And the second organized theme in terms of organization and management, they highlighted financing and sustainability, internal communication and capacity building, and integration and cross-border challenges. Funding and sustainable is really important in this case. And some participants also highlight the way that this regional center could work. Perhaps we could think of some mechanism like contribution based on their GDP, or maybe some voluntary contribution as well. And also the way that could keep sustainable perhaps funding and support is that try to demonstrate how they could achieve or benefit from this work of regional center, see what kind of support that we need from governments of country members as well. And equally important with scientific capacity is also the management capacity here. And the last bit one is really important, especially in ASEAN region, where we have a very great heterogeneity in our country. So they emphasize that this could be challenging in our region, but silver lining is that we may be different, but with our differences, then we could perhaps, join force, and they may have different capacity, and that is the beauty of being different as well. And the last theme is external partnership and engagement. First one is multilateral partnership, and also public engagement and external communication. In terms of multilateral partnership is that if we do have support like from WHO or even ASEAN as well, this could further our capacity building, not just the center, how it could function, but also our staff as well. And maybe we could have some sort of a secondment of the staff between WHO and also the regional center here as well. And also the last one, public engagement here. Most of the time when we have public policy or safety measure that imposed in our country or region, whatever, those who affected the most is the public, is the community. And at the same time, community also play the key role. As like, for example, in Thailand, we do have some volunteer workers as well. So we need to loop them in. We need to engage with them properly. And then how to do that, then we may require some sort of a skill in advocacy to try to make them understand, so that whenever it has been imposed, then they know what that means and why it's needed to be done, etc. And just to summarize what I have outlined so far in 3 themes. And just to conclude here, so if going back to our research question, what lesson can expert provide in terms of operationalizing infectious disease control body in ASEAN? So we know that there's no one size fits all. Everything has to be contextualized. We learn from our differences, try to integrate them so everybody wouldn't feel left alone or something like that. So we need to promote a sense of ownership and political buy-in. And in terms of finance, it has to be sustainable. So it could keep with activity like capacity building, and even for incentivize infrastructure and human resources as well. External partnership can also enhance our learning process and also our expertise. And community play a key role in terms of addressing a public health crisis in every country. So we need to loop them in and engage properly. And advocacy would be needed in this case, so that we could build something like a community of safety, a community of, opportunity for all. Thank you. And if you are interested more in our work, feel free to scan in. Thank you.
Okay, thank you so much for the great presentation. Yeah, and do you want the last one first?
Thank you very much. Very important piece of work. And now we both just learned that there's CDC ASEAN Center as well. New knowledge for us. Thank you. Just to, I think you have everything covered. The funding aspect, multilateralism aspect, and so on and so forth. Just one thing maybe useful to you is that also you might want to consider the private sector as well. You mentioned the public engagement, but I'm not sure whether that extends to the private sector. In recent years, us UN agencies, not only including WHO, the UN agencies have been vigorously trying to engage more of the private sector. And it gives visibility, the funding resources, pool resources, and so on and so forth. So that might be one of your considerations. And I think just for your information, WHO is not a funder, so we don't have money. Don't don't expect that we have money. We also look to other funders and member state as well, but we can definitely provide technical assistance. And I think that's our, main role of focus. Thank you.
Right. You want me to address first? Or you want to go? Okay, all right. Yeah. Thank you very much. Very good point. I may not be able to add everything in one. The conversation is very rich. If possible, I like to share more, actually. But when we talk about community, yes, I agree. We do have to look in private sector as well, but we have to be careful because they have their own agenda too. But when this happened, I think, yeah, we do have the point about private sector too. It's more of like a way to incentivize the government to work more as well, because at some point, if private could respond better than the government, then they have something to urge them to work better, right? Set example. But sorry, I did not put it in here, but your point well taken in this case. And in terms of WHO, thank you very much. Yes, but at least WHO have the intellectual capacity that we could learn from, even though it's not financial, but be very confident that we could perhaps take some model or learning from WHO. Thank you.
Thanks for the presentation. Two things. Maybe one thought is, I wonder if you see the new World Bank House Pandemic Fund as a source of funding for this. I think the last I've heard is that it's mainly going to be targeted towards national pandemic preparedness needs, but wondering if you see that kind of fund or promotion of that kind of fund for this body that you're talking about. And second point, as we are at a conference on HTA, I'm just wondering maybe how do you see this linking with the HTA community? Is it an evidence producer, an evidence taker? Would they link up with other types of maybe evidence informed priority setting bodies in countries as well? So yeah, even if you've had any interesting conversations while you've been at the conference, just interested in general hearing your thoughts.
Yeah, I think, I have like short sort of attention thing, so I need to write down everything that you said. For the first point about funding sources, ideally, I don't think that it should be limited, but if possible, I think funding sources should come from national level or even within the region or even the ASEAN itself. Again, go back to agenda and different funder like donor, international partner or whatever. They do have their own agenda and what they want. If it doesn't align with their priority, then then people are probably going to stop funding the work of this center or even the project that we are doing. So that is something that we need to be mindful of as well. It's not that it's not usable. It could be useful, but in terms of sustainability, is not the ideal in this case. And also in terms of how it's related to this HTA event, I would say because, if this center were to function well, we need evidence-based policy and decision. Whatever we will be able to impose in our society, it shouldn't be just merely the expert opinion, right? And HTA could also be a tool that we could use to help, formulate such policy. An example could be like, refer to another project as well during COVID. We sort of provide a model of, reopen our border. We try to see what the risk and benefit of it. And this thing, we use the knowledge of HTA. So, and that's how I could say the linking between this work and the HTA, or even evidence-based sphere. Yeah. Yes.
Yes, please.
And maybe in relation to this, can we suggest a scientific advisory panel to this center, maybe?
Yeah, I agree. I mean, like, yeah, if you run the organization, you might have some kind of like scientific committee to kind of do oversee the organization level, something like that. I would agree that if you have consider the scientific board committee or something like that, might be better in terms of like sustainability of the organization.
I agree. Yeah.
Please.
I think it's a good idea because I think the Center for Disease Control shouldn't only do about scientific but also doing politics too, because they need to collaborate with many countries, and for sure many countries don't want just to listen to the regional center, but they need to have their own policy. So I think it would be good to have like a chief scientist or scientific board alongside with like the board who are oversee about management and politics and policy part. And I think that it can be a balanced view for the center. I think the center itself from this study is very clear. They need to build trust, and there are a lot of different within the region. So the scientific part of the center will be very key for the success of the center in the future. And all the country looking this center don't want just to get policy recommendation, but they want to get from the center is a capacity building activities, because they want to have their own policy too. Thank you.
Thank you so much, Dr. Yot. And actually, I have my own question. What is going to be the greatest challenges of the center?
I think, I'm not sure about just for this center, but it's just how to integrate the differences, really. And even how to let members agree upon this, understand that every one of us, we have our priority of taking care of our own people first. But in fact, in the end, we need to realize that we could really achieve the same benefits from doing this together rather than just doing individually. So I think the very great challenge in this is just first integrate such differences and heterogeneity. And the second one is try to make people have the same vision, like shared vision and shared benefit and understanding for the center.
Yeah, thank you. Any other comments or questions from the floor? Okay, thank you so much.
Thank you very much.